Well, all new here on the 5 o'clock news. DHEC working with providers to speed up the COVID-19 vaccination efforts and issuing more recommendations to get more people vaccinated. This comes as another 3,500 plus cases of COVID-19 were identified today in the Palmetto State.
The health department says the demand for the vaccine and requests for appointments continue to outweigh supply and availability.
Fox Carolina's Matt Kaufax live with us at County Square right there in front of the Greenville Health Department with the latest.
Yeah, the vaccine rollout continues to be the hot topic. Dr. Traxler says that the state continues to receive about 63,000 doses a week in equal parts Pfizer and Moderna, and that rare slots to come in and get a vaccine appointment are filled almost instantly when they become available. That's why the department is saying to continue to administer doses by appointment only. DHEC did concede today there have been some, quote, misunderstandings and miscommunications when it comes to the rollout. One item in particular kept coming up at the meeting, the fact that people who have had their first dose are having trouble scheduling an appointment to get their second one. Dr. Traxler says there is flexibility there, and appointments can be made as early as 17 days after your first dose for certain vaccines. You don't have to wait a full 28 or 21, depending on which vaccine you get. Another big message they're pushing to providers is to not over-order vaccine. Traxler says they must always be able to fill order capacity, so they need to be careful.
We want every vial that a facility receives being actively used to fulfill appointment requests. We want providers to only order the number of doses that they know that they have the capacity to administer the following week. Over-ordering can lead to vials sitting on shelves, and that's the last thing that we want.
That also applies to not hoarding first doses for second doses. She says everything that providers get now should be given as first doses, then they order second doses later on. Traxler also mentioned two other key elements. They are in the process of setting up a call center devoted to vaccine information only at the state level. And she also mentioned the possibility of mobile vaccine clinics in rural areas coming very soon is real. Those clinics would most likely use the Moderna vaccine since it can be kept at room temperature for up to 12 hours. Now, Traxler said they believe, and they consulted with the CDC and Operation Warp Speed on this, that the allocation given to the Palmetto State right now from the federal government is, quote, fair. However, she did also say they hope their allocation goes up sometime in the, quote, not too distant future. In Greenville, Matt Kaufax, Fox Carolina, the 5 o'clock news.